program. The program, it's mainly like using the UK guidelines. You can pay for it if you could buy it. It would be $225, about 500 Rand a year for you to register. It gets updated with new information, tests, and all that. So what we've done, we've negotiated, we're trying to make sure, because the ESMO trainings are limited, we really want to have a proper induction for our doctors and our nurses to improve training. And also the litigations. I think one of the main avoidable factors for the litigations has really been this issue of fetal monitoring, CTGs that are done, that people don't, see the errors, they interpret them incorrectly, they don't do the relevant actions to optimize the babies. So the K2 training, as you can see, this is the main screen. It has got 6 modules. So the first 6 modules is this fetal monitoring training, and it has got fetal physiology, antenatal CTG, intrapartum CTG, cord blood gases, limitations of this fetal monitoring, and intrapartum auscultation. And then the second part is very similar to ESMO. So if you can see the one that I'm showing, the maternity cases, crisis management, we can see that the modules are there: shoulder dystocia, bridge, PPH, maternal collapse, preeclampsia, uterine inversion, cord prolapse, APH. So once you've done the module, it will tell you completed. So it can tell you that in terms of my maternity crisis management, I've completed all the modules, right? And then if you come into the other modules on intrapartum care, it's giving me the dates that I did the course and how I think. After you've done a module, you need to then go. So let's say you choose to do the intrapartum CTG. So I open intrapartum CTG, and it will actually give me, this course will always remember where you last, where was your last, where you were last on the course, right? So it will teach you. I'm just trying to go back. Okay, oh my goodness, this else. Can you just close this one and go back? Okay, so sorry about that. I'm trying to find. Okay, so what the course will do. Okay, it's not taking me to where I want to be. Okay, so I'll use. So the course will take you through the content and how you actually deal with the content. It will give you a teaching, and then after giving you a teaching, it will then give you the theory, and it will tell you, for example, this was on antenatal CTG monitoring. So this is the lesson, why is it important, right, that we do patients like CTGs, during ANC. And then it's very important, as we said, in the hypertensive patients, that you don't rely only on the fetal movements, actually rely on the antenatal CTGs, which was done at 28 weeks. So then what it will do is that it will give you the theory, and then it will actually give you a test, right? So it will ask you antenatal CTG, right, are really used as a way of fetal assessment, and you say, this is false, right? And it will tell you that you are correct. High-risk pregnancies, they need to have this after 26 weeks if you think it's true, right? Indications, and if you think this is true, it will say true. If the patient has polycystic it's an indication for CTG training for antenatal CTG. If the patient has a stillbirth, right, it says there should not warrant an CTG in the current pregnancy. You say false, right? So then it will make you sort of do this multiple choice test, and it will, okay, so if you've read and understood the theory, it will give you these, the fetal movements are felt true, and then it's true. Okay, so that's how the course will go. It will give you a test and a quiz, and then at the end of the day, you would have completed, that module of the training. Then the other part that it will do, I'm just going to make an example with this. It will give you a live CTG, right? So it will give you non-reactive patterns. What do you do if you have a non-reactive pattern? So for example, it will give you that this is a trace. And this thing, people worry that if they don't have very good computer skills, So this course, as you can see, it's mainly you click, it will give you the theory, give you tracings. Unfortunately, it didn't go to the activity that I had wanted for this exercise. So it will tell you theory that, if the people are preterm, their heart rates are normally higher than normal, and it will tell you why, and then, okay, so this is how the course goes. You just keep on clicking in order for it to give you the information. And then after it will explain what's reduced and why is it an indication for action. And then the most important thing is that, for example, here's an activity, right? So it will ask you, here's a heart rate, please answer the question below, right? So it will ask me, what is this baseline heart rate of this patient? So I will say, let's say I will click the answer and say the baseline is 130, and I will submit. And then now, thank you. Then it will say, click, where do you think you see an acceleration in the CTG? Then you will click, and then do you think the CTG is normal or not normal? Then if I think it's reactive, I click, and then it will say, oh, everything that you've said is correct. And then the baseline was 130, and then it will demonstrate where are the accelerations, the tracing was reactive, and then it will move on to show you a different, so most of the CTGs will be like this. So for example, let me just show you this last one. This is an antenatal tracing of a patient who is 39 weeks, and it was a low risk pregnancy, right? So it's showing me the CTG. Then it's asking, how would you classify this trace? Would you say it's normal, it's non-reactive, or the trace is insufficient to judge, right? So let me say I'll make a foolish choice and say, this is non-reactive, right? So it will give you an answer, no, there is insufficient tracing to judge. The baseline variability are normal, but there are no accelerations. However, you can only see 30 minutes of the trace, so this patient could easily be in quiet sleep. And then it gives you the rest of the trace, right? So it will run a trace that you can see, and you can see that the patient was in quiet sleep, and you can see that the CTG starts improving. So now they say, now what do you think of this CTG now? So you can say, well, now I think it's reactive. Né? So then it will say, yes, the tracing is now clearly reactive, right? And there is strong evidence for fetal well-being. So this is how it will. Okay, so this CTG just was the last example. This is a CTG which was for twins.
Dr. Mandondo, yes. It's very useful to hear you talking through it, but we can't actually, I don't think we can see what you're seeing. We're just seeing the K2MS perinatal training program.
Okay. All right.
But actually the way you're describing it, we can hear how it works, but we can't actually see it on the screen. I think it's frozen.
Oh, you can't see it on the screen.
No, I can't see the CTGs.
Oh, okay. Oh, okay. So basically then it will give you tracings. I think this one was an example of a tracing where you have twins and okay. So I think the most important thing that is the second example was actually showing us.
Now
I don't know if
now we can see that, yes.
Okay. So now it's for example, this is twins that are tracing. So now it makes you see that what would you do? Now let's look at the CTG. So it's important if you trace twins, it's very important that you do an outsetting of the twins so that the two things don't lie on top of each other. So it's showing you that, and then it will move the CTG so that you can actually see the shape. It looks like one twin is distressing and one is doing well. Because if you can see the top one, it keeps on dipping, the bottom one is doing fine. The other one seems like they've got late decels. So it will extend the trace, and now it's obvious that the twins' fetal heart rate shows the shallow regular decelerations with poor variability and a non-reactive trace. And therefore, it will show you that these twins were 32 weeks and tell you something about the outcomes of those twins, and then present to you a different trace. So I think that what I want to emphasize is that what we have then done is we've given a log for one doctor and one nurse, or maybe two doctors and one nurse in each of the hospitals. So this tool will summarize the issues that all traces must be for 40 minutes, and then you must see if there's reduced variability, and then it will give you the theory of what you were supposed to have learned, and then give you further examples. So what I want to emphasize is that we have 6 weeks to do the course. We started last week, Monday. It would be very nice if people would actually do the course. You can do the course alone, right, as an individual, but you can actually pick, once you've learned the topic, you can pick the topic and demonstrate it like I'm doing with you. So if you select certain slides, you can have in your morning meetings, choose certain slides, and then you actually discuss those slides or discuss those CTG traces and maybe discuss that theory. But the whole idea is that the one person who's got the password has got to finish the entire course, finish all the tests, and then at the end, it will give you your true false. Then you need to finish all the tests. And what happens with the test? I'm almost finished with this. Oh my goodness, okay. Let me just, okay. So, okay.
Dr. Mandondo.
All right, so I got out of that accidentally, but it's fine. No. What I wanted to sort of emphasize is that you need to finish the test. And once you finish the test, it's going to tell you that the test is finished and it's going to give you a mark. And when it's showing you the mark, it will actually even show you what you really didn't understand. So every CTG that every test that you've done, it will actually mark what you didn't understand. And then when it shows what you didn't understand, then it will point you to the part in the lecture where you scored low. And then it will show you what it is that you scored low on. And then that is how the test will go. So it's to test your knowledge. You do a thing, you do a test, you test your knowledge, and then it will actually give you feedback as well in terms of what you didn't understand about the chapter, and it will lead you to the relevant slides on the thing in terms of so that you can. So I'm encouraging the clinical managers to get protected time, try your best to actually do the course and finish it, because it's very important that we reflect. We want everyone to have access, have a pin, a login, so that they can do this course, and that everyone can have a proper induction. When they start working in our maternities, they will do a full intrapartum and then do the emergencies. We will not stop doing ESMO, but everyone would have read before, and that is the way we plan to use the course.
Dr. Mandondo, which area is this available for? Is this just for Amatola district or for the Eastern Cape, or which hospitals are this open for?
All I've given access to one person, one doctor, one nurse in each of the hospitals in the entire province.
In the entire province, that's great. Any hospital in the
entire province. So people must ask their clinical manager, their doctor, that we've heard about K2, we are interested, and they let the people who are doing the course first read. So we're giving them 2 weeks to familiarize themselves with the content. But what I'm anticipating again is that then they're going to have meetings with the doctors, or they have their own meetings, and then they can show segments, like they can do it live, connect a projector, and they can do some of the demonstrations and some of the slides and the discussions, in the group.
Looks amazing. And so at the moment, it's free access for the next 4 to 6 weeks. But if people are not able to access it in the Eastern Cape, it is something one can also go and Google, and one can pay
yes, you Google and pay.
So there is that option.
You can Google and pay for yourself, which I think is about 500 Rand for the registration for the whole year, with all the updates and everything. But ideally, we're trying to motivate for the department to get the license. But Madeleine, we don't mind if you have partners, people like other people can register as individual hospitals. We're trying to look for other funding sources for someone who can assist us to pay for something like this, because an ESMO training normally costs us about 150 to 200 for 25 people for 3 days. Just the accommodation, the travel, and all that. And at the end of the day, you can't test people. So this thing will you do it at your own pace, you can understand better, and you can actually test yourself and see how much progress you're making. So which is what we're trying to do.
Thank you very, very much. I'm not sure what happens after 90 minutes, but we're at the 90 minutes now. I'm just, in case we get cut off, I just want to say thank you so much. This is the key kinds of presentations that we need to really speak to people who is helping us with things that we are facing in the facilities, and more importantly, also to give us routes and where we go next to improve our skills even further. So in the next few days, everybody that's added your email addresses, I will send this presentation. I will send all the links to all these different trainings, courses, and everything in an email. So just keep an eye out for that. And some more information on the rural onboarding for those of you that want to join it. And just to be aware that you do have DCSTs